are going to move right along to our next session. I see we've got most of our panelists here, so I'm going to see what's going on here. We've got the Arian there, he's coming on screen. Up next, we will have a COVID-19 sharing session and a panel discussion called Lessons Learned and Impact. So this session is going to include discussion from 3 state and local regulators, and the discussion will be facilitated and led by our very own John Tran, who's the retail specialist here in Branch 2. He's going to be our moderator. So welcome, John and team. I will turn it over to you all. I think you're double muted, John.
Okay, can I be heard now?
There you go.
Okay, awesome. And make sure the panelists, if you could, we'll try to keep our cameras on so we can all see each other. I'll signal to you, Randy. I know you're writing things in the background. We'll take down the slideshow as soon as we progress through it, and have everyone talk about their departments and get through that last slide, just so that we can all see each other and have this be more of a conversation. I'd like to welcome everyone this morning to the first panel discussion of this central breakout session. We're going to be sharing some experiences that we've gone through the COVID-19 pandemic. As you know, through the COVID-19 pandemic, we have seen many parts of the country going through cycles of shutting down and opening back up. But really begs the question, what about regulatory health agencies? In many cases, public health professionals, normally tasked with conducting inspections of retail food establishments, found themselves taking on new roles and responsibilities during the pandemic. Today, we've gathered representatives for jurisdictions spanning across the former Central region, representing about a 1,266 mile spread. Thank you, Google Maps, for coming in clutch there. We acknowledge that you'll probably see a bit of yourselves and the past experiences that we've had in the last 18 months as we talk through the upcoming topics. So we want you to recognize that you're not alone and that we truly are in this together. So as the story continues to unfold, we'll take a moment to talk about the lessons we've learned so far and how we can all continue to move forward. So Randy, could you advance the slide? All right, and I'll go ahead and just give a quick overview of our panelists here. We got Kim Carlton, Environmental Health Supervisor from Minnesota Department of Health, Arian Gibson, Associate Director for DC Health, and Scott Widgington, Environmental Health General Manager for City of Detroit Health Department. They're going to go through and talk about their departments, a little bit more about themselves as we go through the rest of the slides here. So next slide, please. Get away, Kim.
All right. Good morning, everybody. If you can't hear me, let me know. I'm Kim Carlton, and I supervise the Partnership and Workforce Development Unit within the Food Pools and Lodging Services section at the Minnesota Department of Health. Our unit is sort of like a mini office of partnerships, but at the state level, in that we coordinate standardization, state training, interagency outreach, outbreak investigations, program evaluations of both city and county health departments that we delegate our authority to, as well as we also run our own inspection programs. So in Minnesota, we have a mix of state and local jurisdictions. Overall, we have a population of about 5.65 million within Minnesota. The Minnesota Department of Health has 77 staff who cover about 50 counties and 1 city directly. And then we also delegate that authority to 170 staff at 30 local entities. So those might be a city, a county, a multi-county community health board, or some other arrangement. Our retail authority is for food service and some institutional foods. Groceries are handled by the Department of Agriculture, which is our sister agency here in Minnesota. But our best guess is that we cover about 22,000 food establishments at the state and local level that are under our jurisdiction. So I think the next slide just has a quick little overview map of our breakdown. So the blue counties are areas that MDH covers, and the yellow and green are our locals. And I'll turn it over to the next one.
Yes, so good morning, everyone. I'm Arian Gibson, Associate Director of the Office of Food, Drug, Radiation, and Community Hygiene within DC Health. So DC is unique in the sense that we operate both as state and local government. We also, we do not have a Department of Ag, so we handle everything in DC. We have approximately 7,000 food establishments. Right now, our staff is essentially a staff of 20, but we are in the process of filling 5 vacancies. And what we handle is we do retail, grocery, food service, and institutional establishments. Thank you.
Hello, my name is Scott Withington. The city of Detroit, of course, people know it as the Motor City that is the center of the car industry still, and from Motown and the Motown sound system. We're a city that has been struggling for many years with high poverty levels and one of the highest percentage population of African Americans in the country. And in the few years leading up to the COVID pandemic, there had been a remarkable renaissance with a climb in the number of restaurants after years of decline. We have 22 inspectors who cover a range of environmental health, including food service establishments. There are 1,900 food establishments in the city, and in the state of Michigan, food law delegates jurisdiction over food service establishments as defined in the law to local health. And we're one of 38 local health departments in the state of Michigan. And the Michigan Department of Agriculture regulates retail food processing that is not FDA or USDA regulated, and distribution warehousing in the state of Michigan. We found the pandemic, of course, as everyone, challenged especially the food industry.
All right, and Randy, I think that's the end of the slide deck. So if you want to take down the screen share, we can get everyone up on the screen. And I'm sorry there, Scott, I think I was a little bit heavy-handed on the zeros. It gave you more work than you usually have. So
yeah, that'd be an impressive number of restaurants per inspector.
All right, right. I know that. So we'll go ahead and just get into some of the questions. I'll have some people backing up to me, monitoring the chat and passable for any sort of questions from the audience. So have those at the ready, type them in. We'll address them as we can. But I want to open up with a very simple one. I think we'll go and start with Kim, and we can cycle through. What additional COVID-related responsibilities did your department agency take on? You can also add in any sort of challenges you might have faced.
Yeah, so I imagine my story is probably similar to many of yours. During the early days of the pandemic, staff were able to participate on a volunteer basis for things like the public hotline and doing the very early days of case investigations and contact tracing. But by about mid-April of 2020, most of our staff were formally assigned to case investigations, contact tracing, a variety of ICS roles like documentation and planning and staffing and things like that. I did reach out to our delegated agencies to kind of get a feel for what they might have been experiencing at the local level. They had very similar situations. They also were working at testing clinics and vaccine clinics. They were responding to COVID complaints in all businesses and public settings, not just the restaurants and places that they're normally accustomed to. They were sharing business relief grants with their businesses. They were doing community outreach. They were out there physically delivering supplies to businesses and schools like signage and floor tape, hand sanitizer. One of our agencies was doing essential services. So if somebody was in quarantine or sick and they didn't have their food or medication, the inspectors were actually going to the store and shopping and then delivering that to them. We also heard the city of Minneapolis, if anybody's out there, went and delivered door to door 400,000 masks within 3 days. So great job to the city of Minneapolis. I personally was involved in writing some of the business guidance for our executive orders, which was a very complicated and challenging process. You know, it's not like our normal rule writing or policy making where we can just decide what we want it to be. Everything had to be approved by the governor's office and the executive office. But it was really important that we were there because in many instances we had to run interference when they wanted to put things into our business guidance that just wouldn't have made sense in a retail food environment. One of the things that comes to mind is, you know, in our meat and poultry processing facilities, they were able to put physical barriers between the workstations to help keep people separated. But so somebody's like, well, we can do that in restaurants too. And I was like, no, this will never work. We can't put physical barriers in a kitchen. There's fire code issues, there's access issues. We can't block, you know, hand sinks, et cetera. So that was quite the experience. We also did a massive amount of complaint and cluster triage, you know, with the number of executive order restrictions related to masking and capacity and whatnot. We had a massive number of complaints come in and also COVID outbreak clusters identified in our regulated businesses. So we set up a triage system where we went from a handful of complaints every week to hundreds and hundreds. So overall, we handled over 1,100 outbreak clusters in our restaurants to date, over 3,700 executive order complaints about masking and distancing, et cetera. You know, we had to really drill down into our communication skills and make sure that we were able to communicate the never-ending changes to our executive orders to our stakeholders. And then another couple things that just came up were, you know, there were a lot of homeless encampments that popped up during the last year and a half. So a lot of our local agencies had to do a lot of work and outreach with our homeless communities to try to mitigate the spread of COVID-19 and also provide for a sanitary place for them to live. Really, the bottom line is our inspectors became the regulatory health experts for places that they had never had to regulate before. So answering questions like, can we have Santa at the mall this year? And, you know, can the DMV open? It's like, they were the experts, so they were being asked these questions, and these were things that they had never had to face before. I'll stop now.
All right, thank you, Kim. I see a lot of head nodding here from Arian and Scott. Arian, do you want to expand upon anything you guys have dealt with in DC Health?
Yes, we dealt with a lot of the same things. Ours was a little bit different because, like I said, we're all in one in DC, and because it was a health emergency, we were actually the headquarters or the operational center for the health emergency. So our team did a lot of things like help with the overflow hospitals and things like that. We did the plan review and inspections for that. We also did things like procuring PPE, disseminating, coming up with plans for that, COVID response plans. Worked our boots on the ground inspectors. They did things like contact tracing, investigations, enforcement of the mayor's order, of the COVID mayor's order. They also manned the hotlines, especially in those early days of COVID. Eventually, we did hire 500 new team members to do contact tracing and to do the hotline and things of that nature. But in the early days, it was our team.
Okay. Thank you, Arian. And then how about out in Detroit, Scott?
Well, we, of course, there's a lot of parallels in our experience to Kim and Arian. We're a city health department, so and so there's some advantages we had is that all the departments that we work with are all reporting to the same mayor and city council. Early on, I saw that after seeing the experience in Seattle and New York, I knew that this was going to be a big all hands on deck approach. So I reached out to the Michigan Department of Agriculture to start talking to them about the plan to divert my staff from food service inspections to COVID investigation and the like, and got an understanding that on accreditation standards that we would, as long as we documented the shift, we never stopped inspecting restaurants, but we did shift to priority inspections only. And then my staff got assigned to everything from contact tracing to other things. Early on, we saw that homeless shelters and nursing homes would be a significant issue. So I worked with the city's housing department and our human services lead to put together work to outreach to homeless shelters to help advise them and to do contact tracing. So we put together a dedicated team for that. We also did a similar thing for nursing homes after we found that there really wasn't much guidance coming from the state to nursing home directors and directors of nursing. So we put together a team to do that. And then we started putting together guidance for restaurants and then all types of businesses in the city and started putting together FAQs to help advise them. I got 3 extra environmental health staff who would be focused on just working with businesses we don't normally regulate to help advise them and to be able to do reach out to them, answer questions, and do investigations of the workplace as part of the outbreak. And then of course, what happened is the civil disturbance in the spring started hitting. And the mayor reached out to my director and said that police had been writing tickets for businesses violating COVID rules at that point. And he wanted to shift to the health department going in the lead with police support to enforce social gathering, social distancing, and other rules in place, which was a completely new experience for my staff. And when they announced the complaint website, we got 300 complaints for the first 48 hours from the public about different businesses that were violating COVID rules. So this was a major learning experience for my entire staff. It did, however, give us closer contact with other city departments, as many city departments were looking to the health department to help guide them. And I think that will have some lasting benefit far beyond COVID.
Thank you, Scott. I am hearing a lot from everyone that kind of the through line between everyone, it was that you really took to regulating, almost regulating the unregulated. And that kind of threw a lot of people for a loop. I know when you signed up for this a career in public health, you want to serve the community and you just never know how you're going to be called upon to do so. But within that realm, though, did you see any sort of, as far as we'll start with Kim again, as far as your normal work, did the regulatory inspection cease? Or how did you guys go about tackling some of the normal run-of-the-mill work that you had to do?
Sure. So we had our first COVID case in Minnesota in the first week of March, I think the 7th or 8th of March. So by March 13th, we had pulled all of our inspectors from doing routine inspections at highly susceptible populations and congregate care facilities and large events. On March 17th, St. Patrick's Day, the governor put his first public accommodations order into place. So all businesses closed in person. And then by the 25th of March, the governor declared a full stay-at-home order for 2 months. So at that point, most of our staff had been already siphoned off to do contact tracing and case investigations and whatnot, but we had really just started focusing on prioritizing our complaints and doing plan review and other activities that didn't require any in-person inspections. So for a good 2 months, there really wasn't much routine work happening. When the businesses reopened to in-person dining in May 2020, inspectors did start coming back in phases. But at that point, most of them were really minimizing their time. And it's great that they were all so well-versed in doing risk-based inspections because they could just really get in and get out and focus on what needed to happen. We had social distancing requirements in place, and the number of people allowed on site in businesses was also restricted. So we wanted to, abide by the governor's orders as well. We wanted to, participate in that. So we really minimized our time on site. But as other people mentioned, we had to look at things that were not under our normal purview, like the executive order requirements for spacing and whether or not they were having karaoke and whether or not they had people standing too close together at darts league, like things that were not really things that we've been trained for, but we had to spend time doing while we were out there. Also, we had to pull our staff from the field a couple of more times. As someone mentioned, the civil unrest. George Floyd was murdered in Minneapolis, which is here locally. So we had a lot of disturbances, and there were times when it just wasn't safe for our inspectors to be out in the field. So throughout the last year and a half, there have been a few times when we just didn't have anybody in the field in certain parts of the state. When we did kind of reopen and inspections started again, in many places, the focus changed to doing enforcement of the executive orders. So our governor here in Minnesota had executive authority from early 2020 through July of 2021 for the COVID emergency. So he was able to put things like capacity restrictions, mask restrictions, and other things into effect for the entire state. Unfortunately, we had a mixed approach to enforcement from our delegated agencies and the state. So at the state, it was very much a high priority to do the enforcement because it was our governor, it was our executive office. But in some of our local agencies, they had no support from their local boards, from their mayors, whomever it might be. And in some of the parts of the state, there was no support from law enforcement. So in some of the places where we had trouble businesses that would just refuse to comply with the orders, and we also had local law enforcement that would refuse to accompany our inspectors, we had some real challenges in those areas. We had several instances of unhappy business owners and patrons physically threatening our inspectors, posting their business card information on social media. So we actually ended up pulling all of our identifying contact information for our inspectors off the websites. We removed our contact information from our newsletter that gets sent out and that we were using to distribute our executive order updates. And our inspectors stopped giving out their business cards and they replaced their signatures on inspection reports with just their inspector ID number. It was a rough time.
I can only imagine. Thanks, Kim. Arian, did you all had to kind of flip how you approach the regulatory inspections? Did you have to stop them, or we all keep on going?
Yeah, so we stopped them in a sense that we went to complaint only. A lot of our facilities they closed down on their own, even prior to our mayor's order. Well, they closed down in person, so they just shifted their business model to Uber Eats and things like that, rather than people coming in and sitting down. So yes, that did occur with us. Another thing that occurred with us, we didn't have the same issues as it sounded like Kim had, partly because we are all in one, so we are the state and the local. And DC, even though it's a city, it's a close-knit city, so we have a great relationship with our associations, our grocery manufacturers association, our restaurant associations. So we worked with them throughout the entire process. We did have a few issues just based on our location, because we are, if you ever been to DC, within 10 minutes you can drive from DC to Maryland to Virginia. So there was a lot of, why is Virginia rules this, but DC is not allowing that? Well, as you may be aware, DC is an urban environment. And DC, just the environment is totally different than Southwest Virginia or Eastern Shore, Maryland. They're more rural areas. So we had a lot of that, but all in all, because of our close relationship with our stakeholders, it went as smooth as it could go.
Thank you, Arian. And then Scott, out in Detroit, status during the early parts of the pandemic, and how it went. Did regulatory inspection cease, or do you guys carry on?
Yeah, as up through the middle of March, we were conducting business as usual. Although, as we saw St. Patrick's Day approaching and saw case counts rising elsewhere, I had my inspectors start calling bars that would normally have big crowded St. Patrick's Day party and urging them to limit or cancel their parties. And to the credit of those businesses, all but one of the bars and restaurants that we reached out to did either cancel or limit their population to about 10 people. And I think looking at some of the other areas in Detroit, that did have a big impact on not having quite as big a post St. Patrick's Day surge. But then as the cases started to increase, by the second half of March, I had put together a new inspection policy that authorized doing phone inspections in lieu of routine inspections, phone consultations, documenting places that had closed for COVID, and would count as well. And we did see that by the end of March, and when the first executive orders from the governor came out, we probably had 2/3 or more of our food service establishments had just outright closed, and even into the middle of the summer, at most 50% had reopened. But as we shifted our staff to other duties, we scaled. The number of inspections were limited to the riskiest establishments, complaint investigation, the very limited number of foodborne illness complaints that came in, which I think was an unexpected surprise that dropped to almost zero for much of 2021. And certain other high priority, and of course, COVID complaints of a variety of businesses, not just ones we normally regulate. And that the fact that we had done had been using software and communication tools and had a mostly mobile food staff to begin with really helped to allow us to adapt quickly to changes, and of course allow them to work from home on days when they were doing mostly contact tracing or the like. And the experience we had was very strong support from the mayor and city council, and in fact, if anything, pushing us to do more whereas we had weekly meetings with environmental health directors from throughout the state. The experience in other parts of the state was very similar to what Kim described. And so as things moved forward, we adapted and changed almost every other week, because the orders would come out from the state with sometimes hours notice before they took effect, and we would then have to pivot to adjust the data how we were communicating with businesses. And we early in the pandemic, the state agencies such as MDARD were not given authority to enforce COVID rules, so we had to start enforcing on businesses that normally would be inspected by the state, such as grocery stores, and that changed by midsummer of 2020, and they were given authority to do enforcement on COVID rules in their regulated businesses.
Right. I remember hearing a lot about that on the phone calls with as I covered Michigan. So I'm hearing a lot about the carrying out of some of the executive orders that might have come from your governors or your mayors. which allows us to maybe pivot a little bit to one of the questions from the audience. There was a question in the chat from Adelaide Green, kind of paraphrasing, but did you advertise or really push for the community to report these type of executive order violations? Or was it just more of a presenting the information being out there that they can discover how to lodge a complaint on their own? Maybe Kim, we'll go in the batting order, and Kim, you could take that question first.
We definitely did not advertise or solicit complaints, but there were a couple of very highly publicized hotlines and email addresses that were set up at the state level just for any sort of inquiry. So there was that inlet. We also had just our normal complaint, inbox that some people might have already known about. So we were getting them all over the place. So we actually set up a shared inbox that we then advertised internally to all of our state agencies that they all filtered into. And then my team, who normally does standardization and training, who were sort of sidelined, actually managed that inbox and did the triage. So that's just the ones that came to the state level. Of course, city and county health departments probably got their own batches of complaints in addition to the ones that we sent them, but we absolutely did not solicit or advertise.
How about Arian?
So I'm laughing because no, we did not solicit or advertise, but there definitely was not a shortage of complaints. So what we had to do, because there were so many, I think we got every case of somebody's not wearing a mask. We got everybody who saw that called us. So what we had to do is we actually had to have our IT team build a complaint system, and we also, I'm sure many other agencies did this as well. We built a COVID website, a DC Health COVID website, and we linked that to our complaint system. But no, we did not have to advertise it at all.
Okay. And how about folks out in Detroit?
And for Detroit, we certainly early on got a significant number of COVID complaints about restaurants and a little bit about other businesses. The Detroit Police Department, in March and early April, gave out 600 tickets for COVID violations in just a 3-week period. And then the police department, neighborhood police program, reached out to health to assist them with investigating complaints. So we started coordinating so that one of my inspectors and an NPO would go to a business where there had been a complaint, and then the complaints came from a variety of places. By midsummer, the state had set up a complaint hotline that would filter complaints down to local health that were received by the state. Michigan Department of Agriculture set up a similar system to filter them down. We, in the city, we set up a hotline with a call center actually staffed by Quicken Loans initially, who had great technology to put together both an electronic reporting system and a call center very quickly. And that system would then filter the calls that came about COVID to appropriate departments, programs within the health department. So people calling to report cases would go to investigation. People calling with complaints would come to me. And then eventually I had to add people to receive those emails because they were becoming overwhelming. And then the big came is the mayor, as he decided he was going to have, wanted to have us start inspecting nightclubs at night with the police. So shifting my staff to work from 8 p.m. to 2 a.m., going to bars, restaurants, and nightclubs, initially in the Greektown area, popular entertainment section of the city, and then spreading citywide. So we would go with someone from DPD, and one of my staff would pair up to go to these establishments. And that was a challenge. Then come October, the instructions from the mayor were for the health department to start issuing tickets for places that violated. Previously, what would happen is if they were out of control and couldn't get it under control themselves, then the police would shut them down that night. And he announced on one of his press conferences the ability to file complaints with the health department. And that's what led to us getting 300 health complaints the first day and a total of 600 during that first 3 days. Fortunately, it did taper down, which I did expect, but during that period, the expectation was that every single one of those complaints would be inspected within 24 hours.
Wow.
With 22 inspectors. So we did get that under control, and actually by the end of the second week, we were able to reach out to each one of them and investigate each complaint within at least 48 hours. And the mayor was asking for weekly reports on our complaint investigations and enforcement.
Seems like a lot of people to have to satisfy in terms of that reporting. But it seemed from that, some of your experiences, that you all did get some help in one way or another, that you weren't just sent out there to carry out these executive orders with a thermometer and a flashlight only. So, but there was a question from the audience as well that kind of speaks to that. Tracy Weeks asked, I think specifically to Kim, what in the chat, was there any response or support from the governor's office or others in terms of the response, or did it all just fall upon the state health?
Yeah, I mean, so for agencies that were under for counties that were under the jurisdiction of MDH, the governor, it was his order. So he definitely supported us doing the work and doing the enforcement. We used our regular enforcement procedures that we would use for any, restaurant violation. And it's an administrative enforcement process. So we don't give tickets. It's a multi-tier process. But many of the cases, if not most of the cases, actually did get referred to the Attorney General's office. And we had a good working relationship with them and an ongoing working relationship with them that we are paying them a lot of money for now, of course. But yeah, I mean, internally from the state, we did. As far as our local agencies that were struggling with local support, it is what it is. The governor had his orders and the local agencies enforced them as they saw appropriate. So that was definitely a challenge.
Okay. And there's another question coming through from the audience. I believe this is just directed at anyone, but I think maybe Arian, because I know you, Kim, you said you didn't issue a lot of citations or tickets, but in the chat it says, what was the fee that was assessed for the citations that your jurisdiction issued?
I can touch on that. Under the governor's order, they had the option for, the orders had either a misdemeanor or a civil infraction as an option. After discussions with the law department and internally, we decided the civil infraction was the right route. And the mayor's office supported that because he didn't want to see someone end up with a criminal record because their customers were out of control. And the fine would be set by the court when the court date occurs, up to $1,000. But I fully expected that the courts would give much lower than the maximum in these cases. And actually, we found the court has not yet heard a single one of these cases. So the only ones that got a fine would be ones that turned in and pled guilty and said, send me what my fine is. And those that I heard of, the fines were in the neighborhood of $100 to $200. But not a single one, the person who contested their ticket has gone to court yet.
Okay.
And on our end, our fines range from about $500 to about $2,000, depending on the violation. So blatant disregard for some of the more major mayor's order. So like if a club was packed at night, full capacity, that would be a $2,000 fine, a summary suspension. But if it was something more minor, let's say improper signage, for social distancing or something like that, it would be 500. And most of those, we negotiated a settlement. If they came up with a plan and they corrected the items, we would negotiate a settlement and just let them off with a warning for the minor infractions.
Yeah, we issued tickets only for the major infractions. And we then started also issuing for the repeat offenders or the over-the-top offenders, we start issuing summary suspensions of their business license. And then for some of those, they had to come to an agreement with not just the health department, but also with the police department before they could reopen. And so in some cases, there were some public safety benefits because they had to put in better security plans to address fights and other things that the police have been having trouble with that particular place for a while. And the shutdown for a few days to a week or two was seen as a much bigger threat to the fear by the businesses than a ticket that may or may not get some amount of fine eventually.
Right. I hadn't thought of it that way, but that's true. You probably lose more by just staying closed.
Oh yeah.
For
for
sure.
a nightclub, being closed for just a Friday would cost them a lot more than $1,000 fine.
So true. I think the questions from the audience have slowed down to a trickle. So I have a kind of as we're entering into maybe the last third of our session and time we have together. Very probably easier question to answer, but what is your current operational status for the staff? Are you just kind of going back to normal and getting back out there and just trying to tackle the full backlog? Or is it some sort of hybrid as you've been doing? Maybe Kim, you want to start out?
Yeah, so our field staff and staff who have field duties are back in the field doing their jobs. They're dealing with the backlog by dealing with high-risk facilities first. Staff who have more training or administrative positions are still working from home, such as myself in my living room here today. We'll probably go back in a hybrid situation someday. A couple of more, program points is that our inspection frequency is defined in state statute for MDH as well as our delegated agencies. So we just administratively decided last year that we were going to declare a frequency holiday from March 2020 through, we ultimately ended up at September 1st, 2021. So when we perform our delegated agency evaluations and when we look at our own internal stats, we're not going to be looking at any inspection dates for that time period. And then also what we've done with our standardization is we reached out to FDA and asked their permission for an 18-month extension on our expiration dates or recertification dates for our two FDA standardized individuals, and they granted that. So thank you, FDA, for doing that. We've also extended internally within our state program, we extended everybody's expiration date out 18 months. So that's helping us deal with this sort of matrix of an 18-month blip where we haven't really been able to do our normal work. So it's almost like time passed without us noticing it, but yeah, it's been a challenge. We have faced some fiscal challenges. We've not yet returned to our pre-pandemic number of licensed establishments. So licenses equal revenue for us. Last year we offered some refunds for unused licenses that were for places that maybe they were seasonal and they hadn't opened up for the year. And we also put a bunch of hundreds of active licenses on hold at the state level. So we're still struggling with some lost revenue from those businesses that haven't paid for their license. And as I mentioned before, we also have hundreds of thousands of dollars in invoices that we need to pay to the Attorney General's office to date. So, but I mean, as far as doing our work, we're pretty much back to normal.
Okay. Kind of normal, but not quite so normal. We'll get there, right? Hopefully one of these days. And then Arian out in DC, current operational status, how would you deem it?
Yep, we're back to normal. We've been back to normal since probably last October when we hired the additional staff. So we've been back to normal since then, minus a brief pause around the holidays, around Christmas and New Year's, because we did have a big spike in cases then. So we paused probably for about 3 weeks to a month, but we've been pretty much back to normal for a while now.
Yeah, and we've gone back and forth as we moved more staff to and from quote normal duties. We've put a focus on inspecting the ones that had been longest since their last inspection, as well as the high risk facilities. So the complex food operation, such as a Chinese restaurant that was overdue, would get higher priority than say a coffee shop with limited food service. And we're slowly catching up. The state of Michigan put a pause on their accreditation cycle. They were actually in the last 10% of the previous accreditation cycle when the COVID pandemic hit. So they're still in discussion of how they'll finish up that last accreditation cycle. But it looks like we'll essentially not be judged on on what we did through the end of 2021, as they know that every department was strained to be able to get normal frequencies completed. We also lost a number of inspectors, including some of my best inspectors. One discovered they loved contact tracing, so took a job with the communicable disease division, and now is focused on Legionnaire's disease investigations, case and foodborne illness. So we'll still work with him. Some others left to pursue other opportunities, including one who was hired by a restaurant chain to be their food safety expert. And we're struggling to get through HR to replace those positions. So, and that's proving to be more of a challenge than I would hope it would be. And of course, everyone is facing trouble with getting enough applicants. I'm sure with just like the private industries that we regulate are maybe even being hurt harder by that than they were by the pandemic.
Right. And as you are kind of returning to some semblance of normal and getting back out and doing your inspections, how have you all felt that the interactions are with industry? Are they happy to see regulators back, or has the COVID and maybe it's still going, and it ties a little bit into a chat question, if COVID-19 orders are still part of some of the inspections, right? But overall, as you've returned back to those facilities, have you seen, strained relationships, or how are you guys overcoming that, if there are, or has it just been kind of like, okay, there's a blip on the radar, it never happened?
Yeah, well, here in Minnesota, I think it's been kind of interesting to see it parallel to our normal jobs. Some of the operators see our inspectors as a partner and a resource, and they welcome their presence, and there's always a good conversation. Some operators are just indifferent, and some operators are still really, really angry and want nothing to do with the inspectors. And I think it really depends on where in the state they're located and what their personal experiences were with enforcement, what their personal beliefs are about what the orders were that they were being forced to comply with. But I think generally speaking, overall our inspectors are seeing that the businesses are just struggling mostly just because of the business climate right now. They had a hard time keeping up with the executive order changes. A lot of them lost a lot of money from being closed for a long time. Now they're having troubles finding staff. So they're working with skeleton crews and people who've never worked in food service before. So like when our inspectors go in, it's not that the businesses aren't, happy or mad to see them. It's just that they just don't have the time to devote to going through an inspection when they're there. I did hear one note that there's a lot of opportunity for writing a lot of orders because they're seeing a lot of violations just due to the short-staffed and low knowledge base in the kitchen right now. So inspectors are having to really focus on where to balance their priorities. Are they going to, spend a lot of time doing training, or are they going to just write a bunch of orders and get caught up in their inspections? So.
Aaron, how about in DC?
Yeah, for us in DC, what we have seen is whatever the relationship was going into the pandemic, it has just intensified or increased. So for the good operators who we had a strong relationship with and who tried in large part to follow the rules and do the right thing, our relationship strengthened because we worked with them more during COVID. We did a lot of outreach. For the ones who were habitual ones who would push the line and try to get away with stuff, the relationships have decreased because those are the ones that we had to do enforcement activities on and to write tickets and close down during COVID. So it's just whatever it was going into COVID, it just intensified.
Yeah, I would say that that what Arian said is some accuracy, but actually I've noted a shift in some of the places that maybe have been a bit challenged before, where there's actually been some improvement with some of them. Early on, I worked with the Detroit Restaurant Association, and the city put together a variety of packages to support small business, put together a program called Detroit Means Business. It was a central source for resources and information for businesses. I participated and worked on that program. While the businesses were seeing the enforcement being done by the city, they're also seeing a lot of support from the city for trying to deal with some of the challenges. Like early on, when masks and disinfectant and such were difficult to find, the city put together a program that businesses through that Detroit Means Business could request assistance with finding some of those supplies. And they had a central source for identifying loan and grant and the other resources that were available, and multiple repeated webinars to support business. I sent out emails early on, and I've seen that some of that early support during the formation, the period when it was first hitting, has had some lasting benefit. I, of course, reminded my staff that while our job is to enforce safety, to remember how tough this period is on the businesses we regulate, and to make sure they speak with compassion and understanding to them, even if we're telling them they have to close down.
And I will say, due to the nature of our industry, food establishments, they actually had an easier time adjusting to life with COVID than other industries, because we all frequent hand washing and sanitizing and things like that. So it wasn't a huge adjustment like it was for some other industries that we may regulate.
Okay. We're approaching about 5 to 7 minutes. I think I'm on different timers here, but we're going to be wrapping some things up. So I'll kind of put things into one final question, maybe kind of a silver linings question, and we'll go through the batting order here. But in terms of a lot of the changes that you made through the pandemic, and obviously it's still going on right now, we still have things to deal with. But are there things that you all are thinking about carrying through into normal operations when things kind of return back to the way they once were? That's one part of it. And then also, I'll just leave some time on the tail end of your question if you just want to have any remarks that you want to make towards the audience, and we'll get through the remainder of our time. So how about Kim?
Yeah, I think with same as a lot of folks, we're really shifting more to thinking about what we can do virtually, continuing to do virtually, rather than doing in-person meetings and trainings. We've found a way to really do this in a positive way, and are agencies and our inspectors have really appreciated that. I think a lot of our delegated agencies have also used this as an opportunity to provide more online training, more online, opportunities for their businesses too. So that's something I think is never going to go away. Just maybe one takeaway from this is making sure that you know who your stakeholders are in this kind of an emergency. And if there's an opportunity for you to elbow your way into decision makers, if you see something that affects your businesses, like get in there. Like when we were dealing with all the executive orders and the guidances, our manager, Angie, who I know is out there, made sure that we had a seat at the table so we could put our input into these decisions that were being made about, can we put dividers in the kitchens? Like, absolutely not. So figure out who's making those decisions and get a seat at the table. Thank you.
Arian.
Yes, so we did do virtual pre-operational inspections during COVID, and that's something that we're going to continue. It's just, it allows us to get a lot more done. But for recommendations, what we realized during COVID is, although we had strong relationships with our stakeholders like the Restaurant Association and things of that nature, a lot of times what happens is that because a lot of the members are owners and they're not on site at the establishments, what was happening is the information that we would disseminate through our stakeholders would not necessarily filter down to the boots on the ground workers. So we have created a few work groups so that we have an avenue of communication to the actual ones who will be in the establishments. So that's one of the things, one of our major initiatives going forward, to make sure they get the proper information.
Right on. Scott?
Yeah, and I would say that the pandemic put a spotlight on public health in general, and due to the efforts that we put to be able to identify, because this was a disease that spread through environment, especially indoor environments, that it showed the value of environmental health in identifying ways to reduce transmission of disease. We grew our contacts and recognition from a wide range of constituencies. The City Council has an increased understanding of the value of the health department as a whole and environmental health. I now get questions sometimes from City Council members individually. I have to remind them there is a channel they're supposed to go through. But and then we also grew a relationship with other state agencies, including the Michigan Occupational Safety and Health Administration. In fact, early on, our former health officer came out of your department, Arian, Dr. Caldoun, and is now the state's top medical advisor. And I put in a recommendation early on to remind her of MIOSHA as a tool that the state could use in developing regulations on industry. And so I'd say that we'll see how long it lasts, but I think there's been a glow put on public health that will help us to move forward other initiatives in the future.
All right. And I thank you, Scott, and all panelists, Kim, Arian, and Scott, for joining me in sharing this sharing session to the greater former Central region. And I don't know if you all noticed, there is another question in the chat. I'll kind of rehash it back in the passable chat if you want to stick around and answer the question as we get on with the other parts of the breakout session. So thank you all for your time. Truly, we've all been through this together. It's still happening, and hopefully we'll get back to where we can all be in person again and share some more of these stories in the future. So I'll throw it back to Kenya. Thank you, panelists. Thank you.
Thank you, panelists and John. Very good job. Very good information. Thank you for sharing that information with us. And kudos to you audience members. I'm giving you guys a round of applause here because you guys were very interactive and very engaging in the chat. And we like that. Keep that going for the rest of the evening, especially for our last two sessions, because that's where you're really going to get engaged.